Hey, I just did this live on another page. Did not realize I was not on my page, so sorry about that. And I just wanted to come on really quickly and share my thoughts on Mental Health Month. May is Mental Health Month, and I've had personal experiences through friends, family, dealing with mental health, and I just think it's really important that we can speak openly about mental health and the stigma around mental health. Hey, J Mac, thanks for joining, so that we can help the people who need help. And I really want to share some of the resources that I know of that can help people dealing with mental health issues. Hi, Maria. Thanks for joining. I'm talking about mental health today. So, first and foremost, when someone wants to take a day off work for a mental health day, right? Which I did suggest in my one of my recent posts. I shared that I took a mental health day. The first thing that you are probably going to be concerned about is like, what do I tell my boss, right? Like, do I tell them like I'm sick, because technically you're not sick? So when you're feeling down, maybe a little sad, maybe not like yourself, like how do you take that day off work without feeling like you're going to be penalized, or you have to tell your boss all of your business, because you may not necessarily want to share that with them. So first and foremost, like anything else, like if you had the flu or a UTI or anything else, you would go and see a doctor for it. So likewise with mental health, if you are feeling sad, even if you're not clinically depressed, if you're feeling anxious, hey Alan, thanks for joining. You don't have to have anxiety disorder, but you can talk to a doctor about that. If you don't want to go into a doctor's office, Rodox or another telemedicine company can help you on the evenings, can help you on the weekends. And I like calling mental health or therapist visits post checks, right? So in medicine, and you want to see if a patient is alive, how do you do that? You check their pulse. Well, people refer to mental health visits as pulse checks because sometimes when you're feeling like sad and depressed, it's kind of like you feel like you're dead to the world, right? You feel like um, you're living, but you're not really living, right? So a pulse check is that checkup where you just go to your therapist to say, look, how's life? What's going on? It does not have to be because you need medication. It does not have to be because you need to be hospitalized. It doesn't have to be because you're crazy. It really can be just, hey, I want to talk to my therapist about this horrible breakup that I just went through, or about how much I hate my job, or about these issues going on with my family where I need to learn how to manage my family better so that they're not causing a lot of stress to me. And that could be your family like your husband and your kids, or it can be your family like your sister or your mom. There are a lot of dynamics between families that can be very stressful, okay? So that's a reason to see a therapist. On top of that, there are people that are truly clinically depressed. There's something called functional depression, where you get up every day, you go to work, you go out with your friends, you do things, but inside you feel bad. You wear that mask every day. You're so used to wearing that mask that you just carry on with life like it's nothing. That's something that can be treated and get you to the point where you're not just going through the motions, but you actually feel better. You're actually enjoying life. It's not just medicine, it's therapy to give you the tools that you need so that you can better handle some of these situations that life throws your way. So, one thing, couple areas specifically I want to point out, people who are suicidal, okay? Some of them will tell you, some of them will not tell you. So if you suspect a friend, family member may be suicidal, ask them, right? Because sometimes they're thinking it, but they're not going to tell you. But if you ask them, they might tell you. In the doctor's office, if we are treating anyone with depression, anxiety, we're supposed to ask them, and we do. Usually, that's the only time a patient would disclose to me. Most times, they will not just volunteer, hey, doc, I'm thinking about killing myself. If someone admits to you they're suicidal, the next thing you need to ask is, do you have a plan? And what that means is the people who are going to commit suicide have probably thought about how they're going to do it. If that person tells you that they have a plan, then that's the point where I think it's important you get a doctor involved to try to get them treated. And if they have small children, you don't have to call anyone, but just talk to them about, well, if you do that, what will happen to your kids? Unfortunately, we lost a member of our medical community on Mother's Day. That was very devastating for me. Did not know her personally, but could relate to her story in many ways. And, you know, people who spoke to her said they didn't know that that would be their last time speaking to her. So just hearing about that, being touched by that, really compelled me to just speak about mental health, because if collectively we can save a life, let's try to do that. So telemedicine is an option. If you want a doctor to see a doctor in person, you can use resources. Look on the back of your insurance card. You can go to websites like Psychology Today. You can also contact the local medical society. If you're here in Houston, it's the Harris County Medical Society, and they usually will have a doctor's directory that you can get the names and phone numbers of therapists in your area that may be able to help you deal with those problems. Okay. What else did I want to share? Personally, I struggle with postpartum depression. After you have a baby, you're very sensitive. I felt very self-conscious about my body. My relationship was unstable at that time, and it had an impact. I was in residency, I was in business school. At the time, I didn't realize how much I had on my plate, but I had a lot. So if you know a new mom, just show her a little extra love, give her a little extra attention. Everyone always knows to ask, how's the baby? How's the baby? But make sure you're checking on your friends. And I want to say thank you to ACOG for pointing out that 6 weeks is too long. Moms need to be seen by a doctor before 6 weeks. Telemedicine is a great option for them to do that if they can't get out the house. You know, maybe they had a C-section, or maybe they don't have the family support to get to the doctor. So whatever resources, if you have to take a day off work and spend an extra day with that baby. And so Maria, my good friend here in Houston, said check on dads too. And absolutely, because it's a stressful time for both parents. Both parents might not be sleeping. Mentally, the father may be distressed by this new role, this new responsibility of being a dad. So check on dads too. The reason I specifically pointed out moms, because they're at high risk for postpartum depression for up to a year after they have the baby. Remember, pregnancy affects your hormones, and it can be going this way and that one. But we do see the cases where the fathers have hurt the child. So it is important to check on the fathers too. On average, one doctor a day commits suicide. The suicide rate of female physicians is double the rate of all other women. 1 million patients a year lose their doctors to suicide. So yes, we are here to take care of you. But if you have a friend who's a doctor, family member who is a doctor, make sure you tell them that you care about them and you want them to make sure that they take time to go to the doctor, that they're taking care of their mental health, that they're not afraid to take a day off because their hospital or clinic administrator gives them a hard time about having to reschedule patients. Those patients will live being rescheduled, but that doctor could potentially die because they're so burned out and so overwhelmed by this system that puts high demands on us. Students, when I was in college, I worked security for the front desk, sitting, swiping cards as student came in, and a part of that, we got to review the incident reports, and people did commit suicide at our school, University of Miami. I'm sure it happens at schools all over. So if you know a student starting college or stressed about graduating soon, make sure that you're checking on them. Our young children, especially in that age range of 10 to 13, they're being overexposed to social media, and there's a high rate of suicide in that age group. So if there's a young member of your family in that age range, encourage them to journal, pay them a little closer attention, make sure you're checking on them and making sure that they're okay. Take them for a day and go do some activity with them. Maybe both of their parents are working, and maybe their parents have multiple kids and they're stressed and they're distracted, and you may be the godmother or the aunt that could really make a difference in showing that child some extra attention and making sure that they are getting the attention they need, so that we don't keep losing our kids and our friends and our family. Mental health is real. It's a real issue these days. People see other people's lives, and I think it's Real Talk Kim posted very recently, the grass may be greener, but the grass is not always green unless it's fake. And I believe that. So, no, they don't have to share the good and bad with you. That's a personal choice. But realize when you're looking at people's lives, just because they share the good, that doesn't mean that their life is all good. Some people may just choose, whether for superficial reasons or good reasons, not to share everything. For me, I'm sharing with you. I'm not Viva Glam today. I'm just a regular doctor in the clinic, no face beat, nothing like that. That's the real me, because I want you all to know that this is the real. Yes, like I may post a glammed up picture when I'm on vacation or whatever, but in real life, I'm a real person with real problems and real responsibilities. So I hope no one will look at my life and think, oh, wow, I want to be her. Well, I hope you look up to me in a way that is, I want to help more people. I want to do more good. I want to be a positive influence. I want to encourage others. I want to uplift others. I want to have a circle of influence that's positive, but not in terms of the house I live in, the car I drive, how many degrees I have, or the clothes I wear. That's not my goal in life. So if anyone has any questions, feel free to ask. If you catch the replay and you want to ask me a question later, you can direct message me. You can comment on my page. You can contact me through Rodox, and I would be more than happy to answer and share. Last, before I want to go, just say, loving memory of my father, Kitson Rowe, again, who did commit suicide, which is why I'm so passionate about mental health, and I hope no one else has to go through that and lose a parent that way. So let's take care of each other, guys. So hope you have a great day. I'm gonna go see patients. Talk to you soon.